Hi, everybody, and welcome. My name is Neil Seidman, and I'm the co-chair of the Public Education Committee for ADAA. That's the Anxiety and Depression Association of America. And welcome to our webinar, Anxiety and Depression in LGBTQ Youth. What do we know and how can we help? And we're really fortunate to have our presenter is Dr. Alexandra Hamlet. So before we start, I'd like to say just a little bit about ADAA, the Anxiety and Depression Association of America. ADAA is the leading nonprofit organization in the field of anxiety and depression. And our mission is to improve diagnosis and promote prevention, treatment, and cure of these conditions, anxiety, depression, stress-related disorders, through the website, through education like this webinar, and through research. And we work to end stigma and get the word out that these conditions of anxiety and depression and related conditions, they're real, they're serious, and they're treatable. So I especially want to invite you to spend some time on the ADAA website, adaa.org. It's really a wonderful resource. And we have a really great list of treatment providers that you can find right from the homepage. And also we have a free peer-to-peer online support group. And again, you can find that link right from the homepage. And also you can support ADAA by making a charitable donation on the website. We'd appreciate that to help these kinds of programs. So let's get started. So I'm really happy to introduce our presenter. Dr. Alexandra Hamlet is a clinical psychologist at the Mood Disorders Center at Child Mind Institute in New York City. And Dr. Hamlet specializes in the treatment of mood and anxiety disorders for children, adolescents, and young adults. She's an expert in both cognitive behavioral therapy and a related approach called dialectical behavioral therapy. Dr. Hamlet has many interests in this field. She's especially interested in the impact of social media and technology on the teenage brain. She's given many presentations on this topic. She's collaborated with U.S. News and World Report, Born This Way Foundation, Common Sense Media, and many others. And finally, Dr. Hamlet is very interested in helping the understanding and treatment of mental health issues in LGBTQ. So let me turn it over now to Dr. Hamlet.
Hi, Neil. Can you hear me?
Yes, I can hear you great. I'm so happy to have you do this for us. I really appreciate it.
Thanks for having me, and thanks for the warm welcome. As Neil said, I'm passionate about this topic. I think, unfortunately, we still have a long way to go about educating families and teachers and schools and youth themselves about the seriousness of this population and the needs that come with this really important topic. So I'm really excited to share some of my knowledge and insight with you. And Neil, feel free to jump in and ask me whatever it is you want clarification on.
So okay. Are you seeing the little pop-up so we can get your slides?
Yes, I am. Let me show my screen.
Great.
And
Wonderful. Let me through Greg.
Okay, so as Neil was saying, the topic of the day is LGBTQ youth. What do we know and how can we help? I'm going to give you some statistics and some practical takeaways on where to go next in this ever transforming and ever growing subpopulation in our youth. before we do that, I just want to tell you a little bit about the Child Mind Institute, and this is where I come from. I've been a clinician here for almost 4 years at this point, and our mission really is to transform the lives of children and families struggling with mental health and learning disorders. So we have a clinical practice here in New York. We're developing a clinical practice in the San Francisco Bay Area, so that's a big component of what we do. And we also work to destigmatize mental health for youth and young adults. We provide a lot of resources nationally. Our website's incredible in terms of...
I want to just pipe in here and let people know about how to get to your website.
That's a really good idea.
Childmind.org.
Childmind.org. It has so many resources, not only on this topic, but on so many others. We have a symptom checker. We have resources in different languages on how to address trauma in schools or issues at home in all different areas of mental health and learning needs. So the website is a fabulous resource. I have a lot of teacher friends who use it all the time, and families as well.
And it's easy to remember, childmind.org.
Yes, childmind.org. And so we have a resource push towards the country and the world. We have a clinical practice, and we're also doing really interesting research on how to objectively measure mental health so that our future youth can go to a doctor and it be really kind of, this is what you're suffering from. This is the disorder that you have. This is how your brain is working right now. And it's really pretty cutting edge. And so I'm really proud about all three parts of what we do as an organization.
Great.
Okay. So here's a bit of an overview of what I'll talk about today. I want everyone to understand some of this terminology to begin with, so we have a basis for discussing LGBT and Q and what that even means. I'll go over some of the stats, and then, like I said, I'll go over how we can help as parents, as teachers, as individuals that know someone that may be gay or trans or thinking about their gender identity and sexuality. And then, of course, I will give you some resources on where to go next.
Great.
Okay, so let's get started with these terms. And what I want to emphasize first is that these terms can be confusing. There's some overlap. Different individuals identify with different terms. Some don't identify with using terms really at all for themselves. So it really depends on the person. And my recommendation would be to not necessarily assume what someone wants to be called or how they identify. You can always ask. And I would also say that's a good practice for pronouns as well in this day and age. And I think it's really important to show that level of sensitivity because we don't want to assume.
I think one thing that's interesting about the fact that there are 5 letters, and there probably could be more, that it shows that there's a lot of diversity within this population.
Yeah. Yeah, and I think we're at the stage in talking about this where we're still going to be a bit more broad, and eventually I think it's really important that our field start to really hone in on all of these subcategories because there are 5, and I would even venture to say there are more than 5.
So tell us about the first 5, the LGBTQ. What do those stand for?
Okay, so the L is lesbian, and that's really more defined as a woman who has a physical, romantic, or emotional attraction. It doesn't have to be all 3. It could be 1 or 2 of the 3 towards other women. And some lesbians may actually prefer being called gay, right?
Okay.
So it really depends on the person. That's why I always say ask. Gay is similarly physical, romantic, and or emotional attractions to people of the same sex. So it could include man to man or woman to woman. Bisexual is someone who can form physical, romantic, and or emotional attractions to those of the same gender or to their opposite, to another gender. And what's interesting about bisexuality is it could come in different degrees over time and in different waves. So, you know, one stage of life versus another, it could be different attractions to different people. And what's also important is just because the person hasn't had an experience with one gender or another doesn't mean that they can't consider themselves bisexual. Just a little caveat there. Transgender is, you know, what's really interesting about gender is that it is different from sex. And it's a really complicated distinction, and we're still working on that, to be honest, in terms of our jargon. But generally speaking, sex, we want to think about sex as more of a genetic or biological difference between people, and it can include genitalia, chromosomes, hormone levels, right? And historically, it's been male or female.
So that's the gender that I'm born with. That's what you're talking about.
That's the sex you were born.
Right.
Right? Gender is a little bit more culturally and societally driven in that it's really how you feel about yourself in the context of the greater world, or in your community. Right? So it's somewhat more socially constructed, and it develops over time. And sex and gender don't always have to match up. And that's kind of why I wanted to give that a description before going into what transgender is, because transgender is somewhat of an umbrella term for people whose gender identity and or the way that they express their gender. So you can have a gender identity internally that you might not be expressing yet externally or ever express externally. And you might have both a gender identity and expression that doesn't actually match how you were born.
Got it.
Sexually.
Right.
Or biologically.
And then some people that are in that category will have such a strong issue that they might want to go through a gender change.
Yeah. And those people would be considered transgender, and the people that choose not to go through that change can also be considered transgender. It's a concept that the anatomy that the person was born with isn't matching how they wish to present to the world and how they truly feel inside.
Got it. That was beautifully put, that last description.
Thank you.
That mismatch.
It is a mismatch, and it can cause a lot of distress initially if it's not something that's talked about or addressed. And so that's why one of the many reasons why there are some mental health concerns associated with the LGBTQ population. And we'll go into that more with the statistics. But there are some people that simply can't afford to get hormones or, commit to the transformative process to have the gender meet the biology. So, question.
So what is Q? What is Q?
Q, Q is questioning, and I'll go into the other Q on the next slide, because initially I think it was queer, which was not always the most touted term, and now it's coming back in style a little bit. But questioning
it used to be a pejorative term.
Yeah, it was. And now youth are using it a little bit more to define themselves, which is really interesting. But questioning really is this idea of, questioning. I'm not sure what my sexual orientation or my gender identity is yet. And so I'm trying to figure that out.
Okay. Well, that's a really valid, I think a meaningful part of that alphabet soup is because there'd be a lot of kids that would be in that category.
A lot.
They're not identifying with any of the first four, but they're questioning.
And they may, decide to then label themselves into one of the four others, they may also always be questioning, and that's also okay. I think we like labels, and sometimes they can be really helpful, and then sometimes they can be limiting. So, so here's some more terms. I have 2 more slides of terms. I hope this isn't too much. But
so this is the second tier of categories that are part of this population.
Potentially not.
It really shows the diversity here, though. I guess that's a point that I want to make, is there's a lot of diversity within this population.
Agreed. Totally agreed. So like I said earlier, queer is it's also it's a catch-all phrase for a person whose sexual orientation isn't necessarily heterosexual, right? So sometimes, the terms lesbian, bisexual, gay are too limiting, and culturally the connotations might not be in line with what the individual wants for him or herself or themselves. And so they'll use the term queer. And like you said earlier, it has a history of being pejorative, less so now especially with youth. Cisgender is potentially one of the more simple ways of explaining, like everything else can get so complex. Cisgender is a term really that means that you're in concert with how you were born biologically. Right.
So I was born a boy and I identify with male.
Yes.
So cisgender. Okay.
Cisgender, right. Pangender is feeling an affiliation or association with multiple gender identities, right? So they might say, I actually can relate to being male, female, and other genders. And this term other genders really is meant to kind of denote that our binary system is somewhat antiquated at this point. So it's not just one or the other, it's these two historically driven ways of expressing identity, plus other things that we're still exploring as a culture.
Yeah.
So agender is not associating with any gender. It's kind of like saying, you know what, I'm not buying into this culturally or societally driven nomenclature. And that also is okay. I mean, it's actually, a lot of people associate with being agender. And pansexual is, again, attracted to all variations of gender. So, like I said, there aren't just two genders anymore, male and female. It's beyond that. And bisexual might not be appropriate to just talk about their sexual identities because, again, we're just still working in the binary form, and there's other genders.
So people that identify with some of these terms, would we want to include them when we say LGBTQ?
Yeah, I would.
Okay.
I would say yes as a general rule, and because gender and sexuality is so personal and really exists on a continuum for both sexuality and gender, I would ask.
Let them decide.
Let
if they
them
want to identify with that.
Yeah.
Group.
And they may say, I actually really identify with being pansexual. And they might say, you know what? I actually don't care what you call me. I'm just me, right? So it's always great to ask. Okay, slide.
Very interesting. Now, are there more?
Oh, yes.
Oh, boy.
Sorry, this is the last one.
Okay.
So asexual is not experiencing attraction to other people. And this is confusing because in our society, I think some of us think, oh, well, asexual people don't have sex. They don't get married. They're kind of like these little, these people that kind of stay away from, as much socialization in terms of the sexual and gender kind of realms. And what I would say to that is, they can still do those things, and some of them still do those things, and they still aren't really attracted to other people. So, they still may want to have kids. They still might want to get married, and they're just not attracted to other people in the way that the other categories were denoting.
Okay.
Sexual fluidity is this idea that at any given point in someone's development or lifespan or sexual history, there's an attraction to different genders, and being open to having relationships sexually with a gender that maybe the person hasn't had exposure to yet or isn't normally attracted to. Non-binary is a little bit more of like if you zoom out a little bit more from all of these other terms, and it's just this idea that there are people that really don't exclusively identify as male or female, like I was saying, and it's becoming more and more common that people are thinking more dynamically about their sexuality and their gender beyond these two, girl, boy, male, female, binary constructs. Sometimes the pronoun they or them is more fitting as a result. And then lastly, also kind of more of a zoom out concept is this gender nonconforming idea, which is basically to say I'm not going to sexually identify or gender identify with one particular category. And some, non-binary and trans people identify as gender nonconforming.
So one thing I get from all of these descriptions is a sense of inclusiveness and allowing for all these individual differences.
Yeah. Finally, right? I mean, I think it's been a long time coming, and I think we're finally becoming more sensitive to the differences of human beings, right? And what that entails, both from a sexual standpoint, from a identity standpoint, and I think it's a great thing. It can also be confusing, which is why we're having this webinar. So I also wanted to just make a point, because sadly, I think I have to make this point, that mental health and LGBTQ, it's not necessarily that if you are a lesbian or you're gay or you're trans, that you're automatically going to have mental health issues, because those constructs are mental health concerns. Our way of diagnosing in psychology and psychiatry doesn't have gay, as a diagnosis. It may have in the past, right? But certainly doesn't now. And what my point in saying that is that we aren't necessarily addressing the needs of these populations well enough to prevent their mental health issues. So basically what's happening is stigma and negative experience as a result of being oneself. And that might be a little different from the way we historically have been thinking about gender and sexuality, is what's causing the mental health issues, not the actual.
That makes a lot of sense.
Yeah. So we need to get better at that. And that's where I'll get into how we can help and the resources. We are starting to get better, and we still have a long way to go. So that's really what this slide is about.
So the last point on your slide, I just want to reinforce that you say stigma and negative experience, we're talking about young people, is likely the root of mental health issues in this population.
Yeah. So we can do better. And we're getting there. I will say that. We are getting there. So to hone in on that point, I'm going to give you some stats that may or may not make people feel good about things.
So this is where we are now, what you're going to show us now.
Where we are now, yes. And this, I mean, you'll remember, Neil, when I first sent you this deck, I had maybe 3 times the number of slides on stats. So this is the top of where we are. And there's the good news about the loads of stats that I initially provided is that there's research being done on this topic. That's a good thing. And so that means that we'll be able to then deliver better interventions because the research is driving the direction of the field, which is where we want to be.
Yeah, and being able to state the problem is really helpful.
Certainly, that's how we solve the problem. Yeah. So we're on the right track. So I want to talk about youth as a whole, LGBTQ youth. They're way more likely than non-LGBTQ youth to be struggling with their mental health. And that's, again, due to the increased stigma and discrimination that they face, sadly, not only from their families, but also from their peers, and just society at large. We're getting there. We're not there yet fully. And as a result, this population experiences more depressive symptoms than their peers, 4 times as much, 2 times as likely to feel suicidal. It's a real problem.
That's a huge risk.
Yeah. I mean, 2 times, 4 times. These aren't small differences. These are quite large. And, within this big umbrella term for the trans population, more specifically, 1/3 has considered suicide. And one in 5 hasn't necessarily felt suicidal, but has gone to the level of making an attempt, a suicide attempt. So I think because there's even more complexity sometimes with sexual, like the expression of sexuality and gender in trans, it provides almost more of an opportunity for stigma and discrimination, and so the trans population in particular, and it's a newer emerging subcategory too, so there's potentially even more work to do around stigma. It just ends up being that even more so, this subpopulation is quite at risk for mental health concerns. And online sexual victimization is also a big risk for this population.
What do you mean by online victimization?
Just relational,
like social media, bullying, that kind of thing.
Exactly. And as you know, I mean, more generally, it's sometimes easier for someone to be mean online because it's not a face-to-face interaction. There's less accountability. And yet it feels extremely painful regardless for the person who's being targeted. So that's likely why it's such a big issue. Okay, and home life. I think parents and families, they can be more supportive than they are as a whole, right? These are large studies. I'm not talking about specific families, but at large, families at large. LGBTQ youth, like any population of youth, thrives when their home environment is supportive. It's not a shock, right? And school as well. But only 25% of families are showing support by getting involved in LGBTQ communities as a way of trying to understand and bridge that gap between their knowledge and their child's needs and knowledge. Negative comments are being made quite a bit still at home, both for those youth who have come out and then those who have not come out.
Kids are going to be sensitive to those kinds of comments that they hear growing up.
Yeah, and it's not a surprise that the kids that haven't come out are having even more negative comments. And so that might make you wonder, well, is that one of the reasons why they're not comfortable coming out? Right?
For those that are not out to their parents, the research shows over 3/4 have heard bigoted comments.
Yeah, over 3/4. That is such a staggering amount. It really is. And less so, but still very high, 2/3 for those who are out. So parents are still saying these negative things when they know their kid has come out. So we need to educate families more, not just schools. And
then I like your last point, which is really dramatic research, that you say at home only 1/4 of LGBTQ youth can say that they can definitely be themselves at home.
Yeah, that's a small amount. I want to see that way higher. Okay, so Conversely, if there is support at home, there's higher levels of self-esteem and overall health, right? That makes a lot more sense. And the highly accepting families are the kids that aren't necessarily suicidal. They're not as depressed. Their overall health mentally and physically is stronger. So we need to be educating families, communities about how to approach this topic with their kids and with youth at large in general. And so,
boy, and this is dramatic, this last point on your slide. So you talked about how transgender population is got even more challenges. And yet here's research that transgender kids whose family acknowledged their gender identity were as psychologically healthy as straight peers. That's fantastic.
It is.
Very dramatic.
It is.
The role of family support.
Well, it just goes to show that it's not the actual categorization of sexuality or identity. It's the response from the environment that really kind of denotes whether or not mental health will be exacerbated in a worse form. So with mental health concerns develops poor and unhelpful ways of coping with mental health. So it's no surprise that substance use is higher in
twice as high, it looks like.
Twice as high with drugs and alcohol. And what's important to really think about is teens, youth that are experimenting more with drugs and alcohol in that time frame are more likely to have it become more of a chronic, lifelong issue. So it's not just a youth issue; it becomes more of a whole lifespan issue for substance.
It's like an attempt to cope, like you said, not a helpful way.
Right. I mean, yeah, and that's truly what I think is happening. It's not necessarily that they're not connected. I think they're very connected. They're feeling sad. They're feeling anxious. They don't know what to do. So they're going to turn to these substances as a way of trying to feel better. Although, like you said, not helpful in the long term. So, yeah, rates of substance almost 3 times the rate of heterosexual peers. And there's already enough trouble with substances in teens. So let's not triple it for this population is my vote. Yeah. So, and then over half of LGBTQ youth say that they've used alcohol and drugs compared to less than a quarter of the non-LGBTQ youth. So twice the amount is basically what that's saying for LGBTQ youth is using substances in the stages of teenage development, young adult development.
Did a little pop-up come up on your screen? I saw a little pop-up.
Oh, yeah.
Something.
Can you see that?
Yeah. Can you get rid of it? Yeah, we go. Thanks.
Yeah. Oh, that actually makes me realize I should close all of my windows because of my email. Sorry. Okay. So now's the topic of education. Education, teachers, this is a really important area that a lot of national organizations and even local organizations are going towards in order to help this population get more support. Because a lot of time is spent in the classroom and with teachers, and if a parent isn't as welcoming of these populations or of their children who are saying that they're different than heterosexuality, teachers can really be that support and peers as well. And I think the reason why a lot of resources are going towards schools is because of these stats. So almost 3/4 of LGBTQ youth have been bullied at school.
That's just staggering.
Yeah, and only 25% feel safe in class, which is also really staggering. So, for our LGBTQ youth, their concern in class and school is bullying and family non-acceptance, which is wild compared to non-LGBTQ youth, which admittedly they're concerned about their grades and their classes and their exams, right? Which is what really, I don't like to use the word should ever, but it's really unfortunate that LGBTQ youth can't focus on things that will potentially make them into these really well-adjusted, happy, successful adults. It's just not fair, I don't think.
And if there was a supportive environment in their school and they felt safe, then they could be doing these priorities with their learning.
Right.
Instead of just trying to get through the day.
Right. It's almost like a hierarchy of need. They can't necessarily get to the higher level thinking as much when they're feeling threatened.
And then this last point on your slide is really dramatic.
Yep.
3 LGBTQ kids drop out of high school at 3 times the rate.
Than average. I don't have the stat in front of me, but this makes me think about homelessness. And there's a staggering statistic about the rate of homelessness in youth that are LGBTQ. Not only because of dropping out of high school, but because of family non-acceptance. So we're seeing disproportionately large amounts of homelessness in youth being due to LGBTQ issues with acceptance and not feeling like they're able to finish school or be accepted by their families. So it's a public health concern too, right? To not address this, because homelessness is just, such an issue in so many major cities. Just yet another reason to take all of this seriously. So the performance for kids in these populations is lower. Great GPAs, the tangibles are lower in these kids than non-LGBTQ kids. They're twice as likely to be called names, experience verbal harassment, and be assaulted in school. Be assaulted in school, right? That's unbelievable to me. And 60% of LGBTQ students feel like, they're not reporting incidents to staff. And that makes me wonder if it's because they don't have the hope or the faith that the staff will know how to handle it or can make a change. And so one of the things I'll talk about later is a lot of resources are going towards educating and training teachers and staff about how to handle and manage reports of assault and bullying in the schools. And then 1/3 reported of kids who reported an incident said that nothing came of it. So I can imagine that creating feelings of hopelessness and potentially leading to depression, right? If you don't feel like you're going to an adult, you're asking for help, which is hard enough, and then you're not getting a response. This is another stat on school verbal harassment, physical harassment, and assault. And you can see the numbers. Verbal harassment, 81.9% have been harassed for their sexual orientation and 63% for their gender expression. Physical harassment, taking it even, a step more in an invasive way, 38% for sexual orientation and 27% for their gender expression. And then almost 20% have experienced full-blown assault for their sexual and 12.5% for their gender expression.
Very discouraging.
Yeah.
But this is like you were saying, this is where we are now.
This is where we are now.
And it's important to, just realistically see what's the situation, what's our starting point.
Mm-hmm. And then the last stats slide, I'm sure everyone's ready to move on. But youth self-harm and suicide. So the risk of self-harm, which would be examples, could be cutting, it could be burning, it could be, repetitive behaviors like, banging heads. Like those are a few of many examples of self-harm. 2.5 times more likely each time there's a verbal or physical harassment. So again, the development of poor coping strategies in the face of some really, really tough social interactions. And LGBTQ youth are 4 times more likely, and questioning youth are 3 times more likely to attempt suicide, experience suicidal thinking, and engage in self-harm. So just another stat along the lines of, depression, suicidal ideation, self-harm, it being a real issue. And as you know, or as the audience may or may not know, the rise in suicide over the last few years has been pretty steady for youth, and it's really a big concern. And my guess is part of that population of youth with, at large, is this LGBTQ population. So if we can help these populations, we could get that number down, I think, considerably.
Okay, now we're getting to something that we can do.
Thank goodness. I didn't want to depress everyone for too much longer. There are things we can do, for sure. And the first part is, what can I do as an individual, whether I be a teacher or a parent or a friend, a mental health provider. This isn't necessarily a community-based slide. It's a personal slide of what you can do one-to-one to help. And with many people, this advice would work. It especially is helpful for the LGBTQ population. You want to listen. You want to be non-judgmental. If you have judgments, try and keep them inside, right? Either verbally or non-verbally. Meaning, if you're not really sure of how you feel about what the person is saying to you, try not to roll your eyes. Try to just be as non-judgmental outwardly as you can.
So expressing like some acceptance.
Yeah.
Whatever his or her individual differences might be.
Yeah.
And just to be able to listen, and that really conveys a really profound sense of acceptance, just listening.
Yeah. And you bring up a good term. Acceptance to a lot of us psychologists isn't necessarily agreement, it's acknowledgement. And that's the starting point. So if a parent isn't really sure that they agree, and I'd imagine at first it's a hard conversation to swallow, the initial conversations of coming out. Start with acknowledgement and build towards agreement. So that's just a nuance within the word acceptance, in my opinion.
So I can disagree and have all my own emotions about my kid, but the starting point is just being a listener and conveying some level of acceptance that this is what my kid or this person in my life is going through right now.
Mm-hmm. Right, and that's what validation means is acknowledging, right? Really just saying, yes, I can see that this is what you're saying. I can hear it. I am taking it seriously, and I'm right here with you. I might not necessarily be in full agreement, and I'm hearing you. And what that does is it strengthens the bond between two individuals, and it allows for more conversation, which is inevitably what's going to need to happen as the coming out process evolves. And it is an evolution. It is a process. It's not just a one conversation type of a thing. If you think about the word identity, and this is what we're talking about, either sexual or gender identity, of course it's going to be more than one quick conversation. So the dialogue, keeping that dialogue open is really important between an individual and a person who is expressing vulnerability in the area of identity. Now,
the kid that's part of the LGBTQ, how does that kid navigate who to come out to and how to deal with that? Because he or she isn't necessarily going to know how it's going to be received, and whether they're going to get any kind of acceptance.
Right. Yeah, it's a really hard question, and it's so individualized. So I wouldn't give a blanket response to that. What I would say is, this is I think ideally it's going to be a very well thought out process for the individual. So it's going to potentially take time for the person individually and personally to think about it. And during that time, they could be observant of their environment as to who is generally more open and understanding and who generally is less. In an ideal world, parents are told first. And that kind of supposes that the individual has a really good relationship with their parents, which isn't always the case. So it doesn't mean that the person has to tell the parents. But, people who are questioning and thinking about their identity tend to be dynamic thinkers in general and very observant. So they can probably pick up very well on, who might be more sensitive and who might not be.
So who's an adult in my life that is likely to be accepting?
Yeah. And one of the things I would say is, it's taken seriously quite a bit. And you might want to, tell the most important people in your life first, rather than everyone. And then you're kind of having to interface with a lot of people, which can be overwhelming. And it might invalidate the feelings of the people that matter most. If they know, oh, wait, so you told me along with everyone else? Well, so I'd say, do it in stages. Tell the people that mean the most to you first, and really have that evolving conversation, and then start to broaden. Yeah. Yeah. And, expect that you might get some confusion, right? I would say almost like prepare for the worst, even though that's really negative. There's probably going to be confusion. There may be some negative comments. There may be some, jabs and say like, well, you might need therapy then, right? Or, and when the person is very clear and has thought about this for a long time, that's super invalidating. And I think it's almost a knee-jerk reaction sometimes for feeling some strong emotions on the other end. Remember, the person who's coming out has had time to think about this and has thought about it for quite a bit. The person that's being told, it's potentially somewhat of a surprise, sometimes not, and they're going to need time to process it as well.
All right, so how about maybe a little guidance for the LGBTQ individual to see if you can have some acceptance of how your loved one is initially responding.
Right. With big life changes, mutual acceptance is key. And so, yeah, it's funny because the LGBTQ person is asking to be accepted and acknowledged, and so reciprocally, that could be really important for the parent. So you also want to make sure that your safety is guaranteed when you come out. If it's not guaranteed, you're going to have to come up with a plan, and you may want to wait until you have a plan, because your safety is the most important thing. And again, hierarchy of needs, your identity is so important, and your safety is even more important. So consider that as well. I'm hoping that that's less and less of an issue over time. And I would imagine that it still is an issue. So that's a top level consideration, a really important one. Yeah, so you also want to empathize with parents, and because you've done your research and because you've thought about it, you might actually give your parents some tips. Or the people you're telling some tips as to where they can go and what support they can get, and to really educate them in general about the terms that I talked about, and maybe even some of the statistics, which can be empowering. You
could show them this webinar. Give them a link to this webinar.
Yeah. Yes, I would love that. So the other thing parents and adults can do, which is the opposite of validation, is problem solving. As a society, we like to be change focused, right? Okay, let's fix this. Let's do this. And so try to just listen. There might not be anything to do. And if there is something to do, you might not know what it is yet, because how would you know as a parent or as an adult exactly how to handle this. It's okay for a parent and an adult to say to a young person, you know, I'm really going to think about what you said, and I'm going to do my own research, and I'm going to get my own support so that I can handle this in a way that I think is best for you and best for the family. Adults, I think, sometimes want to have the answer, and saying that they don't is equally as valid. So yeah.
So, and there might be, say, a problem that needs to be addressed in the school. But what I'm hearing you say, well, you know, but start out just with the listening and developing and nurturing that acceptance and mutual acceptance. Start there, give that some time. And then, you know, what issues are there that need to be addressed?
Exactly. One of the things I think that's most actionable and can be done immediately is to make the person feel loved and accepted. That word acceptance again. If a person feels like they don't have all the answers and the family doesn't feel like they have all the answers, but that bond is still there, I think that's really the best that can be done in conversation 1. And 2 and 3. All of them. You know, once a child comes out, and if you suspect that a child or a teen could be LGBTQ, you want to model that difference is okay, and that you celebrate difference. And you also want to acknowledge eventually, if not immediately, that this isn't a phase, right? This isn't something necessarily that was just thought of yesterday and is being told today. Assume that the person really has thought about it for quite some time, because that's usually what happens, right? It takes a while for someone to develop the confidence to really finally say it. For the parent or the adult, I would say you're going to have emotions. That's okay. Try and keep them under control to an extent, because kids and teens and youth, they want to feel like the adults in their lives are the stable forces. Now, that doesn't mean they have to have all the answers. It just means, okay, I'm going to take this in. There could be a few tears. I don't mean for it to feel like a robotic exchange. But there might also be an urge to really sob or to really yell. And I would say that's probably going to decrease the level of comfort that individual has with coming to that adult again.
So as the adult, I don't, in this first conversations, I don't have to jump right to expressing and vocalizing the emotions that I'm feeling. I want to start with, can I just convey some love and acceptance? And I can acknowledge my own emotions, but I don't have to do it right then in that conversation.
Exactly. You can always, as an adult, you can always say, if it's hard to control, you can always say, give me a minute, I'm just going to run to the bathroom, right? And let that emotion out a little bit, and then kind of try and refocus back on to the situation.
I think that's a really good tip, really helpful tip.
Okay, good. I'm glad. And like I said, we don't have all the answers. Youth certainly don't, and neither do adults. And so seek out professional help or other support, and some of the resources that I'll give you will have that support. And as a family or as individuals, the support is out there now, which is fabulous.
Yeah, and we'll get to that in just a few minutes.
Yeah. Another thing that kind of shows validation, actually not kind of, it does show validation, is asking questions, not necessarily in a way of being overly judgmental, but just more curious questions, because you don't want to assume anything. So you really do want to ask questions to try and really understand where the person's coming from.
Like what is it like for you?
Yes.
What's it like at home? What's it like at school? Just some open-ended questions to get the kid to share.
Yeah. How has it been not being able to fully be yourself, and really starting to understand, because no one can truly understand one another's pain. Even someone who has come out versus someone else who has come out. Those two pain levels and experiences are different, even though they share a similar experience. So we never want to assume we know exactly how someone's feeling. And we don't want to assume they want help. Now, in this population, it's very clear that it's more likely that the person will need help. But again, at first, we don't want to go jump into problem solving. We want to go to the validation, exploration part. And we also, like I said earlier, we don't necessarily assume that the person needs to tell their parents as the first point of contact. I would say any adult is better than no adult. And that's where I would start. So a community leader, teacher, counselor, family friend even. And as long as the individual who's coming out says, hey, listen, I'd like you to keep this a secret for now. And I wouldn't like you to tell so-and-so, and that person can respect that, I think it's okay.
Yeah, good.
So coming out has its benefits, right? It creates higher self-esteem, greater comfort, obviously, with sexuality. It can, over time, help destigmatize certain areas, right? Less homophobia if there's more of a conversation about it. And like we said earlier, less substance abuse as well.
So just in general, I mean, acknowledging all the challenges that you've described and how a kid can navigate the coming out process, but just in general, the process of coming out in a safe way, in a maybe a gradual way, in a well thought out way, has huge mental health benefits.
Yeah, it can. And, I also want to be sensitive to the kids in in parts of the country where there's less support. And I also want to really hone in on the idea of, if it's not safe, really come up with a different plan.
Right. Which might mean delaying.
Yeah. Unfortunately, yes. But in an ideal world, yes, that coming out really provides so many benefits. So another actionable item that an adult can take in a kid's world is to make sure that their other environments are up to speed with research, resources, and training. And a parent or an adult, feel free to be as pushy as possible to get this done. Because sometimes the louder the signal, the more likely the action occurs. So, educate teachers and staff at school that there's more incidences of bullying, physical and verbal aggression, grades being lowered, an increase in substance use. Make sure that staff and administrators and teachers have access to resources online. There's a lot of free stuff out there too. It doesn't even take a lot of money for people to be now finally trained up in this area.
So parents can really have a really positive influence on the school.
Yes, for many issues, not just this one. And usually the louder the voice, the more gets done. That's probably the case in a lot of areas of life. And remind yourself that you can regularly contact the school to make sure that they're, being held accountable for some of the things that you're asking of them. I would also talk to your child to make sure that balance is there, because they also may have certain requests of you as an adult in kind of meddling in with their school life. So you want to make sure you're having an open dialogue with your child about how much they're really interfering with the school. And you as an adult can friend request your kid and be part of their social media world, whether they like it or not, because that's where you can start to kind of look for signs of bullying.
So that's another environment. So we've got home, we've got school, and now we've got social media. And the parent can really get involved in, just like you were saying in the last part of the slide, looking out for signs of bullying in social media.
Yes. Yes. So another area is that, support groups and social activities, whether they be on online communities or in real life, community building at large is such a powerful part of this. And that's why a lot of the resources that we'll talk about include a community building component, whether it be virtual or real life. And it really helps people to feel like they can be included. It reduces rates of depression, and it creates a sense of belonging, which is what's been missing quite a bit from a lot of these kids' lives.
So the kids can get support, not just from family.
From each other.
Yeah.
Yeah. And if that doesn't exist in a school for whatever reason, it can exist online. So social media may not be such an enemy always. It could be really helpful. So I put 3 different slides in about teenagers and youth in general, about when to really kind of not worry, when to start to think about there being some issue, and then when to really seek help for your kid. And this doesn't just apply to the LGBTQ population. It's a guideline for adults to really think, okay, what's typical, what's potentially a little concerning, and then when do I really need help? Do we have time for that, Neil, or should this just be a reference for those who have access to the deck?
Well, yeah, I think that what you have on this slide is, you could just go over these quickly. These are just kind of normal developmental challenges that kids are going to go through, and popularity, becoming more independent, concern about appearance, strong emotions, exploration of sexuality, trying on different identities. So all these are just normal growing up issues that don't necessarily mean there's anything that has to be addressed, but just to be connected and be aware. So I like this is a good slide that people could pause and read.
Yeah. And I think as it relates most to LGBTQ is, your kid will normatively be questioning identity and in general and thinking about sexuality. It doesn't mean that they fall within the LGBTQ population necessarily. It means that that's just part of development. When you want to start to think about there could be some rumblings of issues mental health wise, is you really know your kid the best. And if you see deviations from behavior for more than a few days, you might want to think, okay, let me observe a little more. Maybe you don't jump into action, but you observe. So any anxiety or edginess, potential irritability, more outbursts or reactions to things that were previously not necessarily the child wasn't reacting to or the teen wasn't reacting to. A little more secrecy, although I will say secrecy is part of teenage development as well, and that's normative, but more than normal. And feelings of being withdrawn, which could denote anxiety, depression, suicidal thinking, bullying, right? These are things where we want to start to see if it lingers or sticks around.
Okay, so these are things to get a little bit more attention.
Yes. And then clear warning signs would be noticing self-harm, a child or a teen saying that they're having thoughts of suicide, even more withdrawal, changes in eating and sleeping, changes in grades. If a kid was doing stellar in school and then it's dropped, I mean, that's definitely a clear warning sign that there's something going on. More emotionality. The other thing I would say is too, like if there's a lot less emotionality, so if you're not really seeing the outbursts or what was normally happening, it was more of like a, yes, everything is fine kind of a thing, where maybe that's not how they would normally act. You also want to question that. And then any increases in alcohol or substance use. Some parents and adults might say to this slide, well, how do I know, right? If kids are even more secretive in this stage, sometimes there's a sense that you get, sometimes there's a lack of being around. There might be a change in peer group. And that's when you might want to push a little bit or prod a little bit more in these other areas.
So this slide can show us some red flags.
Yeah.
Where these are issues to really delve into and be taken seriously, because there can be a real risk involved here.
Yeah.
And that if you see that there are some red flags here, then your message at the top, this is time to get help.
Yes. And this is, again, for any mental health issue, right? Not just the LGBTQ youth. This is really any kid or a teenager. Now on to this last blue slide, national resources. There's way more than just these 9. We highlighted these 9, but there's so many resources out there now, locally and nationally, to really help this population out.
So on this slide, we already talked about the childmind.org as a wonderful resource.
Yes.
The first one I want to ask you about is one that I've seen quite a bit, the It Gets Better project. Could you tell us a little bit about that?
Yeah, I like this resource because it's really about connecting the population. So it's really about connecting people that are experiencing similar things, like coming out or thinking about transitioning, starting to really question their identity or their sexuality. And it's about putting them all together virtually and in person, and really, again, providing that support system. And a lot of organizations do this, but this is one of the major tenets of It Gets Better.
And is it itgetsbetter.org? Is that the website?
I believe so, yeah. And what they also do on their website is they provide access to community-based service providers. So, the closest people to wherever the person is living, that can help with these issues, right? Specialists that can help with these issues. And they developed educational guides and resources for not only schools, but for parents. So those are free. I actually logged on, put in my email, and I was able to get a ton of free resources. And you don't need to be a teacher to see the teacher things. And you don't necessarily need to be a parent to see the parent things.
So that's a great resource to spend some time on.
Yes, I would agree.
And then another one I've heard of is the Trevor Project. Can you tell us a little bit about that one?
Yes, I don't want to be biased, and I find Trevor to be phenomenal because they really understand youth in that they don't just have a hotline. Kids aren't necessarily as open to talking on the phone anymore. And so they have a hotline where counselors can be accessed 24/7, 365 days a year, to get support for crises, suicidal thinking, and support in general for coming out and struggling with these issues associated with coming out. But they also have a text hotline.
Oh, that's great for kids.
Yeah, and then they have a chat. So you can go on your computer too and do like a chat, and get really, really quality help, no matter where you are in the country.
Is this mostly for kids or also for parents, the Trevor Project?
Well, I think you could probably utilize it as a parent as well. I think they're super inclusive and they just want people to get help, no matter where they are in the country, because there are some areas in the country that don't have in-person help as much, and so these hotlines and these forums are really important.
So I want to give a message to kids especially, that you can Google the Trevor Project and find the website, and you don't have to wait until things are desperately terrible. You can just connect with them and text with them and just get the sense that, this is a resource that's there for me.
Yeah. Yeah, and you can do it somewhat anonymously and privately, which is also really nice if it takes so much energy and bravery to do this. It can be helpful to lower the amount of asks of the person. You could do it in your bedroom and feel safe. And then they also have an online space, an online social media space for kids and teens and youth to connect. And I actually don't think it's just youth. I think it's really anyone. And I'd have to clarify that. I think it's really anyone that is LGBTQ and is in need of support.
Yeah, wonderful. Any other of these resources that you want to highlight before we wind up?
I think NAMI is more generally about, it's the National Alliance on Mental Illness, and it has great resources for depression, anxiety, any mental health concerns, lots of programs, and they have a helpline as well. Child Mind, obviously, is such a great resource for mental health and LGBTQ needs and questions. We have articles and resources and things like that for teachers and for adults in general and for kids. And I do like the Trans Lifeline because it's all the operators. It's a hotline, 24/7 hotline, and all the operators are transgender. And they're specifically trained, so they're not necessarily volunteers. They're paid. And I think
what a great resource for kids, especially.
Yeah. So I think that one's important to highlight as well. Yeah. The only other one I would say is Family Alliance is great for parents as well, which is not even on here, but certainly worth checking out.
And what's that called? Just the Family Alliance?
Yeah.
Okay. So do you want to go to your next?
Yes, I do. That's really the basics, and I hope one day to come back and dive deeper into these subcategories. But if you have a question for me, email webinars@adaa.org.
Yeah, and feel free to send in your questions, and Dr. Hamlet will address them as she's available. You could put in the subject line LGBTQ. And maybe just scroll down one more time. And thank you so much, Dr. Hamlet, for being with us and giving this fabulous presentation. And I want to encourage everybody to, save the link to this webinar and share it with people in your life that you think it could be a good resource for. So thanks again for watching, everybody, and we'll see you next time. Thanks again, Dr. Hamlet.
Thank you.
Thank you.